Assalamu alaikum. I am Dr. Khadiza from Bashundhara Ad-din Medical College. Today I am going to discuss about RBC. You know, blood is composed of three types of formed element, that is RBC, WBC and platelet. So RBC means red blood cell. Today we are going to know about the normal count, morphology, its function and erythropoiesis. Now what is RBC? It is a red blood cell and its another name is erythrocyte. You can see the figure of RBC. Now morphology of RBC, its shape is circular, flattened and biconcave disc, and it is non-nucleated and its diameter is about 6.5 to 8.8 micrometer and its average is 7.3 micrometer. And its thickness is more in periphery, that is 2.2 to 2.5 micrometer, and centrally it is less, that is 1 micrometer, and its surface area is about 140 micrometer square, and its volume is about 90 to 95 micrometer cube, and its lifespan is about 120 days. And its appearance is, it is circular, dark ringed, and it is centrally pale, and its content is hemoglobin but no nucleus, no mitochondria or reticular materials. So what is the advantage of this biconcave shape? It is biconcave shape, so it can easily pass through the narrow capillaries, and it has a large surface area for gas diffusion and at minimum distance for gas diffusion and accommodation of more fluid in hypotonic solution. You can see in this figure that red blood cell can easily pass through the capillary in a single cell, that is capillary diameter and RBC diameter is same, so it can easily squeeze through the capillary. These are the figures shows how it become what is the advantage of biconcave shape in hypotonic solution? It become swelled in when it is placed in hypotonic solution. Now what is the advantage of non-nucleated red blood cell? In orthochromatic erythroblast stage, nucleus disappears and hemoglobin forms. So large amount of hemoglobin can store within the hemoglobin to facilitate gaseous exchange. It can change its shape without any tension in the membrane. It can easily pass through the narrow capillaries without rupturing. Now the normal values of RBC. RBC usually is more in case of male. It is about 4.5 to 5.5 million per cubic millimeter of blood. Average is 5 to 5.4 million per cubic millimeter of blood. And in case of female, it is 4 to 5 million per cubic millimeter of blood. It is above, and average is 4.8 million per cubic millimeter of blood. And infant, it is more, that is 6 to 7 million per cubic millimeter of blood. Now what is the variation of RBC count? It varies in different conditions. Physiologically, during diurnal variations, that is highest in morning, and exercise it increases. In male also, after the meal it is increases. In high altitude, that is low oxygen tension causes splenic contraction and increase RBC production from the bone marrow, and in case of male, more they have more large number of testosterone, and that causes increased erythropoiesis. And age, that is higher in case of infants. Pathologically, increase RBC is called polycythemia, and in decrease in RBC, that is called anemia. Value of RBC count, hematocrit and hemoglobin, all this is higher in case of male than women, because we already know they have testosterone hormone. That's why all this count increases. Now we are going to discuss about Rbc indices. Firstly, we are going to discuss about what is hematocrit. Hematocrit, it is the proportion of the volume of the red cell relative to the total blood volume is called hematocrit or packed cell volume, that is PCV. Hematocrit can be measured in different ways. In Wintrop's method, it is usually in case of male 40 to 52%, and women it is 36 to 48%. Usually hematocrit that is expressed in percentage. You can see this figure, that's plasma is it's 55%, then buffy code, then red cell, that is 45%. We can do this by hematocrit method, by centrifugal, using centrifuging machine, so that RBC settle down bottom. So the percentage is calculated in this way. Hematocrit usually varies from tissues to tissues. It is greater in venous blood, that is 45%, then arterial blood it is about 43%. In venous blood it is more, because osmotically active particles, that is chloride and bicarbonate ion present here, and chloride shift mechanism also occur here. So so RBC take up water and its size increases. Other hematocrits are other RBC indices are that is mean corpuscular volume MCV, mean corpuscular hemoglobin, that is MCH, mean corpuscular hemoglobin concentration, that is MCHC. So firstly, MCV. What is MCV? This is the average or mean volume of a single blood cell. That is, its value ranges from 90 to 95 cubic micrometer. And mean corpuscular hemoglobin, that is MCH, this is the mean amount of hemoglobin in a single red cell, and its value ranges about 27 to 32 picogram. And MCHC, that this is the mean concentration of hemoglobin in red cells, it ranges 30 to 36 gram per dl of our red cells. So RBC indices are hematocrit, mean MCV, MCH and MCHC. This chart shows the normal values of these RBC indices. Now we are going to discuss about the RBC function. Its main function is to transport of respiratory gases, that is oxygen from lung to the tissue and carbon dioxide from tissue to the lung. And it also has buffering activity. It is responsible for most of the acid-base buffering power of the blood by carbonic anhydrase enzyme, and it maintains the blood viscosity, and it also its vessel is membrane is responsible for determination of blood grouping, because a vessel membrane contain antigen that is specific for a specific blood group. And pigmentation formation, that is it has bilirubin, biliverdin, these pigments. For this it is important. Now erythrosis sedimentation, that is ESR. What is ESR? When blood is treated with a suitable anticoagulant allowed to stay in a narrow tube in a vertical position for some time, the cellular elements will aggregate and gradually settle down, leaving the clear plasma above. The rate of which the cellular elements settle down in the first hour is called ESR. So what are the variations when it increases or decreases? We have to know. Firstly, know the conditions when it increases. The pathologically it increases in tuberculosis, rheumatoid arthritis, anemia, multiple myeloma, chronic infection, hemorrhage, and also in pregnancy. And it decreases in polycythemia, liver failure, and congestive cardiac failure. Physiologically, it usually increases in case of pregnancy and in menstruation in these cases, and also in old age usually increases. So these are the variation of ESR in different conditions. So thanks for watching. Next time we will discuss about the erythropoiesis and its changes.